I didn't know Suzanne Delbanco very well. Almost by definition, I didn't work with her. I came after her as CEO. She had left Leapfrog and ultimately founded CPR before I started. We had one at a time CEOs. However, I do feel like I knew her in a profound way because of what I inherited as CEO of Leapfrog. And what I inherited was an organization with a powerful and a pointed vision, and an organization that cared deeply about people, but also held them accountable. And I came to understand that that embodied Suzanne Delbanco as a person, someone who cared deeply and held people accountable and held herself accountable. And she built an extraordinary organization. And I always feel like she was the wind behind our sails as we move forward into this new, in many years. Every year, there's a new thing, there's new challenges. It always centers us to think about, well, what would Suzanne do? How did Suzanne see this? And that brings us to those fundamental principles that have guided Leapfrog from the very beginning. So I am deeply grateful for her legacy and her memory, and we really wanted to make sure that we remembered her today. Suzanne is the founding CEO of the Leapfrog Group. She is also the founding CEO of another remarkable organization, the Catalyst for Payment Reform. So let me introduce Guy D'Andrea, who is also remembering Suzanne. He is the Executive Director of Catalyst for Payment Reform.
Thank you, Leah. And it's really an honor for me to be here and talk a little bit about Suzanne. I actually knew Suzanne for about 20 years. I started working with her when she was the CEO or Executive Director of Leapfrog, and then later on when she founded Catalyst for Payment Reform. And so it's really an honor for me and a privilege to be her successor in that role at CPR and to carry on the work that she led so effectively for so long. I did want to share, which I had it on my phone and now I've lost it, but in her LinkedIn profile, Suzanne described herself as a serial social entrepreneur who liked to make a difference, especially in areas of controversy. And that really summarizes, I think, the span of Suzanne's career. And it's remarkable to think about the impact she had, given that she wasn't a serial entrepreneur who didn't have millions of dollars backing her efforts, or huge organizations, right? She had basically her determination, her intellect, and her persuasion. And here you're all attending an event that would have been hard to imagine when she founded Leapfrog, that hospitals would be talking about reporting their quality information, sharing that publicly, being accountable for their performance. Likewise, with CPR, Catalyst for Payment Reform, it would have been hard to imagine 20 years ago that about a third of all healthcare payments in the United States would be value-based, that we would be talking about market consolidation as a key driver of price and talking about solutions to that, that both states and the federal government would consider interventions that would help to drive better healthcare value and control costs, improve quality. So the impact that Suzanne created over her years leading these organizations is hard to understate. And I think, again, we're all here, in a sense, as a testament to the legacy that she has created. So I'm very grateful to Leapfrog for setting aside some time to remember Suzanne and her contributions. I'm going to turn the podium over to Bob Galvin. He's the current chairman of Catalyst for Payment Reform. but as he'll describe, somebody who worked with Suzanne and got a front row seat to a lot of the important work that she did. So Bob, please.
Now, that's a much younger me up there. Kind of the same tie, but no gray hair. So, listen, I'm going to spend the next 10 minutes or so talking about Suzanne and talking about Leapfrog. And so look, you're looking at pictures of her. Memorials are sad, and it is tragic that Suzanne isn't with us. But her life was a triumph, and that's what I'm going to focus on. And to do justice to it, I need to go back in history and talk a little bit about what life was like in the late 1990s. I'm seeing about 5 people here who might have remembered that, and the rest of you, it's history. So in the late 1990s, the healthcare system was a mess. Employers had a plan. The plan was managed care. It was HMOs. We were very enthusiastic about it. We instituted them, and employees hated it. And so the managed care revolution turned into the managed care backlash. They were angry, choice was taken away from them, they couldn't see the doctors. We would talk to them about how, well, really the doctor they saw maybe wasn't as good as they thought they was, and maybe, their costs would be worse, and they just weren't having any of it. And when we tried to talk to them about quality, their eyes glazed over at the speed of sound. And so we were really stuck. We basically were in a position where we really did not know what to do. So I remember for the first time, some of you might know the boxer Mike Tyson has a quote that everybody has a plan till they get hit in the mouth. That's how we felt back then. We had a managed care plan and nobody liked it. So a small group of employers got together and tried to figure out, well, what's the next step? What are we going to do now? And the system was in gridlock. Large insurers were making deals with large hospitals. Both of them were making deals with large drug companies. And employers who represented about 160 million Americans were kind of left out. And we felt outmanned and outgunned. And after talking about it for a while, we realized that where we really had gone wrong was that we had left consumers, patients behind. And that the way to not be outmanned and outgunned was to get 160 million people who were covered by employer insurance in the game. The problem was how to engage them. And really then, kind of serendipity struck twice. And the first was a study you all know now, the IOM study onto error is human on the 100,000 preventable deaths in hospitals. And for the first time, the public was not only engaged, they were talkative. Everybody had a story about something that bad had happened to a relative, the doctor that didn't wash their hand, the wrong prescription from the drugstore because you couldn't read the doctor's writing. And they were just completely into it. And so hospitals responded by saying, look, we are trying very hard, we're doing our best, and we're really making a lot of progress. But by that time already, the public wasn't having it. This was an era, even back in the 90s, when the trust in institutions had eroded. There had been a whole consumer movement. Ralph Nader had written this book, Unsafe at Any Speed, about how unsafe practices were built into cars to save money. There were exploding Pintos that were denied by the car companies. And so the public wasn't having it. And what the public said, look, that was the old days, and this is now trust but verify time. They wanted to decide for themselves, who was safe and who wasn't. And so there it was. And I think it came to us that we had a path now to a value-based system, and that's how Leapfrog was born. Leapfrog was born to take advantage of that change in the country. And so it was really dedicated from the beginning to the belief that the way to spur change in healthcare was for the public to demand it. It was about transparency. It's about transparency in capitals and the belief that everyone has the right to know everything about their healthcare. And we had to start where people were, and it was quite important, and that was safety. And this wasn't going to be incremental change. mean, we understood that not every consumer was going to be able to shop for a hospital, but we knew if we made it public, hospitals wouldn't like it, and they would get spurred to action in a way they wouldn't have otherwise. So this wasn't the status quo, and the reason it was called Leapfrog was because it leapfrogged over the gridlock. I also had 3 kids at the time who were playing Leapfrog, and it just struck me as a metaphor that the best way that they tried to get ahead of each other was to leapfrog. And so it was meant to challenge vested interest. It was meant to make trouble in the best ways. And then came serendipity number 2, and that's Suzanne Delbanco. So Suzanne was thinking about moving to DC anyway. She was a Berkeley person because she wanted to be near a guy who she was falling for, that guy who's going to speak in a couple of minutes. And she came east. Arnie Milstein, one of the other founders who might be on a Zoom or call right now, was the one that found her. And a few of us, I think 3 of us, interviewed her. And she basically missed every criteria that we wanted. She had never run an organization before. She really didn't know anything about employers. She didn't know much about the delivery system. And she was really, really young. And we basically all decided she's the one. There was something about her that you just felt was kind of going to be a leader. And again, beneath that kind of winsome kind of personality of hers, as I'll talk about in a minute, she was just tough as steel. So let me just say, it's one thing to come up with the name, Leapfrog, and a strategy. That's great, and it's much, much harder to build an organization from scratch. So here's what she did, with Leapfrog. So she basically was the only employee, so she had to build a staff, and she built a great one. She helped create the initial leaps, the 3 initial leaps. She was a master grant writer. She was like the foundations loved her. And after we had raised some initial money from the Business Roundtable, she was off and running and raised millions and millions of dollars to keep it going. She basically then developed the initial survey. And remember, at this time, it was 2000 now. We got an article in the New York Times. We sent out a survey to hospitals asking them to basically say, here's how many people I'm hurting. So I remember the first few days, Suzanne and I were waiting. I said, anything yet? No, nothing's come back in, anything yet? And somehow over 1,000 surveys came in. We couldn't believe it. And so we figured they would all be, I'm perfect, et cetera, and they weren't. There was a kind of a latent feeling, I think, among the lead providers, hospitals that answered this, that this was a time to get better. And that was also sense. So let me be very clear. There would be no Leapfrog without Suzanne and everything she did. So all this time, she then developed a dissemination strategy, which Leapfrog has today, with employer coalitions from across the country, working with their local hospitals. She gave innumerable speeches. She got all these offers to go run companies and get rich, and she didn't do it because she was so mission-driven. And look, the fact that multiple hospitals today use Leapfrog as a marker, I think, just shows how she fundamentally changed. But let me say something in her words. This is a note she wrote to the founders, and this is a quote. We turned an idea, transparency, that everyone had the right to know everything about their healthcare into a national movement that fundamentally changed the way the healthcare industry operates. Like the man behind the curtain in The Wizard of Oz, we figured out how to use the voice of employers to pull the puppet strings and start the movement by pushing for hospitals to report to the public the truth about how safe and good they actually were. And although we didn't get everything right, there's no doubt that the leaps saved tens of thousands of lives over the years. No small accomplishment. And so look, Suzanne was always generous, and it was characteristic that she said we. Again, there would be no Leapfrog without Suzanne. And no one changes the world the way she did without a superb set of skills. And anyone who knows her knows that. She was smart, she was creative, she was compassionate. And then she was also pragmatic, and she could execute. And you don't find those 5 traits in many people. And she was a real leader. She was consistently voted onto the list of the most influential people in healthcare, and deservedly so. But there were 2 other parts of her that I think are important that didn't come across unless you really worked with her. And the first was her courage. So, again, I kept calling her personality winsome, and she is. She was a warrior, though. So imagine this. Imagine, as part of the IOM report, and hiding behind the Institute of Medicine, we said, look at all these hospitals that could do better. She had to go out and stand up in front of the CEOs of someone that was powerful, hospitals in the country, Mayo Clinic, Mass General, Stanford, and tell them that Leapfrog was going to make public how many patient deaths could have been prevented under their watch. And she did this over 100 times in the first several years. That's courage. And another amazing thing that went with the courage, she did this and everybody liked her. You know, I give speeches like that, nobody likes me, but she gave them and everyone liked her. She was a mentor to every employee, a partner to every group trying to improve healthcare. And she continued to be respected by the hospital leaders who she was embarrassing at times. And they really liked her because it was impossible not to. You know, great leaders have this. There's a type of charisma, and it's their inherent optimism, their authenticity, and their resilience that shine through. And there's something about interacting with Suzanne that always made you feel better. So to close, you know, I had the privilege of working really closely with Suzanne over the past 25 years, with Leapfrog and with CPR, as Guy mentioned. We had a standing Friday afternoon call for 25 years, and we missed very few of them. They were certainly the highlight of my work week, and we would sit there and we would figure out how to make trouble for those in power who weren't doing the right thing. And we did it in a way to compel them to improve. You know, Suzanne woke up every day with this audacious belief that she could make the world a better place. And amazingly, she did. So again, it is the definition of tragedy to lose someone like Suzanne at such an early age. But the best way to keep her legacy alive is to do what Leah and this whole Leapfrog community has never stopped doing and is doing brilliantly, which is to remember that patients and consumers are the true north of the healthcare system. And Suzanne would say that all of us should never, ever stop speaking truth to power. Thank you.
Thank you, Bob. Since we lost Suzanne far too early in May, it's really been amazing, the outpouring of remembrances, support, admiration for Suzanne. And I've been struck over these last several months by how specific those memories are. Everybody who worked with her, as Bob shared, really seemed to be better off for the conversation, even if they were on other sides of the issue. And it's just been a profound experience for us, I think, as Leah said, to think about the impact that Suzanne had in founding our organizations, but also on the overall healthcare market. And certainly we're well aware of the loss of Suzanne and the impact that she would have had going forward. As much as that loss, I think, affects those of us who work in health policy, it certainly affects her family more. And so it's my honor to introduce two of Suzanne's family members who can speak to their memories of her, their sense of her contribution and her impact in their lives. So it's my pleasure to welcome Sachu Constantine and Dr. Suzanne Delbanco up to share some remarks. Thank you.
Well, Guy, thank you. Leah, Bob, thank you. Thank all of you for being willing to listen to this about someone you may or may not know. If you did know her, your life was probably, as has been said, changed for the better. There's not much else that I could say about her vision, her leadership, her brilliance, her compassion, and her fearlessness. And I think that's right. It's already been said. We appropriately lionize people like that. She was, as they say, a force of nature. There was little, if anything, that could stop her from achieving her goals, from reaching her objective, from anything that you could think of that she would want to do to anything that you wanted to do, she would make that happen. But if I'm honest, back here in DC, this is where we were first together and I got married while we lived here. Back in DC, some of those qualities are actually pretty thick on the ground. They're probably pretty thick on the ground in this room. There are lots of leaders, lots of people with that kind of strength and skill that can debate as well as perhaps Suzanne could, although I wouldn't bet on them. I think there is a secret, or there is a facet to her, and Bob, I think you spoke to this very well. And by the way, those 25 years of Friday afternoons were one of the high points of her week, of her work, of everything that she did. That was really an important relationship for her. Probably the only other professional relationship that meant more was you, Tom. That secret, that aspect of her that I was very fortunate to experience, and any of you that knew her or worked closely with her were also fortunate to experience, was that these accolades, these skills, this world of titans and achievers and earthshakers that she lived in and worked in and was recognized as a part of, that isn't what moved her. That isn't what made her do the things that she wanted to do. Ego was not the thing to be sought after. Accolades were not the thing to be sought after. They were a means to an end, and that end was doing good in the world. And you already heard that from her colleagues, those closest to her. That is absolutely who Suzanne was. She wanted to make life better, leave the planet better than when she found it. And that, at the heart of that, the heart of what made Suzanne so successful, something, again, which those of us close to her got to know, was in fact her heart. Her capacity to love, to find joy, to find passion in all aspects of her life. She brought that to her work every day. She brought that to her family every day. She took as much joy in tutoring a neighborhood kid in math or English or writing or anything as she did in speaking to governors and princes and CEOs. She worked hard all year to harvest the 3 strawberries that our garden would yield, or the 1 blueberry and the 1 apple, so that she could share it with her family, with her friends, with me, with her sons. And that smile would come just as strongly after that 1 blueberry that somebody else tasted as it did when she got hospitals to recognize that they could do things better. Those were the same to her. And that's, I think, what made her so great. It wasn't about her. It was about the people she was working with, the people that she was serving. What mattered to her were, of course, family and friends, and I'm always grateful for that. But it was also the strangers, the distant planet, the distant environments that her curiosity and her wanderlust always drew her to. That's what she cared about, and that is really the secret. She was true to that all the way till the end. In her last days, she was worrying about whether her kids were going to be at the right college, whether our family, our home was taken care of, was safe for her to leave, and it was. She had obviously done that, but she still worried about it. When you bring that piece of you to your work, when you bring that piece of your life to your work, you are honoring Suzanne's legacy. You are honoring her memory. So I want to thank you for giving me the time to offer this appreciation and this remembrance. Thank you all. Thank you, Leapfrog. Thank you, CPR and the staff and all the colleagues that worked with her on what was really the achievement of a lifetime, although just one of many for her. I know that you will carry the legacy forward. I did want to say one other thing. I cannot tell you how overjoyed she would have been, how much she would have loved to hear the panel that just went right before us. That is what it was about. How do you make healthcare better, people's lives better? Maternal health was one of her big subjects as well. So thank you to that panel as well. But I want to wish you all good fortune in your work, because I know it matters. She knew it mattered, and that's why she did what she did. So thank you, and I will turn it over to you, Tom.
I want to thank you all for inviting us also. Jill, my wife, and Suzanne's mom is in the back. Jenny, her sister's here. Her brother couldn't be here. I'm ambivalent about Leapfrog because my hospital, which I've been at for 52 years, has a B rating. And the Mass General and the Brigham and Boston University have A ratings. And whenever the CEOs, et cetera, of our hospital look at me, they look at me a little cross-eyed. When they used to have A ratings, I was a hero. Everything was fine. But where you sit is where you stand. I thought what I would do is go back to the roots. When she was little, Jill always says she would ask for help when she was about 1.5 or 2 years old. And Jill would say, wait a minute, I'm busy, I'll be right back. And when she got back, everything was done. She didn't need help anymore. I always thought she had 2 brains. And I pitied the first person who wanted to kiss her because she could move her eyeballs separately. And I thought that if she didn't want that kiss, her eyeballs would go like this, and he or she or whatever it is would freak out. She could write equally well separate things with both arms. So I thought, as a doctor, that something was wrong with her corpus callosum, and she actually had 2 brains. And it's interesting that when you talk to her high school friends, the first thing they always say is she was really a force. She went to college at Wesleyan, decided to bulk up, and believe it or not, became a rugby player. And there she wanted to spend a summer with us working in the primary care center that I started up, along with Steve Schroeder, who I see is the namesake for an award that you're giving soon. See, one of my best friends. And at that time, we were in the middle of the HIV/AIDS epidemic, and we had no idea what to do with these patients. This was in the 80s, it was the summer. And we were trying to figure out whether to take care of them in the primary care setting or in a specialty clinic. And Suzanne said, very simple, let's ask the patients. We asked the patients, 50% of them said they wanted to be taken care of by their primary care doctor. 50% of them said we wanted a specialty clinic. So to this day, we have 2 ways of taking care of HIV patients at our hospital and around the nation. When she went to graduate school to get her PhD, she became interested in emergency contraception. And she found out, to her fascination and horror, that patients knew nothing about it, and neither did doctors, and neither did nurses. And her dissertation work was in that area. She made really seminal contributions into, with the help of the Kaiser Family Foundation, where she was working then, and which sponsored a PhD, getting that out to the world. Most of you probably don't know that. Bob Galvin hired her, but she called me the night before. She said, Dad, I'm in the finals of a neat job. I've come to DC to follow the guy I think I'm in love with. I need to get work. I applied for a job. I'm up against 2 50-year-old male fancy doctors who are famous. What do I do? She was 31 at the time. I said, you just be Suzanne, and you'll get a piece of cake. I was right. I'll tell you one more story about her. Early on in Leapfrog, she was invited to talk at one of our Harvard fancy courses. Harvard makes money. God knows we don't need money, but we make money by bringing fancy executives to town for a week. And they sit down. All of them were male in those days, by the way. And they learn about health policy. And this year, when she was invited, it was in the Harvard Law School. And she had to follow 2 very fancy speakers. First was Ken Shine, who was a cardiologist, who was then the president of the Institute of Medicine, which is now the National Academy of Medicine. And the second was none other than Newt Gingrich, who was going to explain how to reshape medical care in his image rather than in the patient's image. And they blathered away for 2 hours. Newt didn't even bother to come into town. He did it distantly. And she's got up there with her dimples. She had amazing dimples, which I think helped her get a long way. And she smiled at everyone and said, "Let me tell you a story. When I was a debater in high school," and she was a national debater, which I think actually prepared her better for her job than anything else. She certainly helped me smithering people in debates afterwards by the techniques that she taught me. And I made some really good enemies that way. But she said, "You guys must be very tired. You listened for 2 hours to these people." When I was in high school, which is not so long ago, I used to come to the Harvard Law School. I would borrow my father's faculty card at Harvard, and I would study for debate. So what I'm going to do is I'm going to tell you about Leapfrog for 5 minutes instead of my allotted hour, and we're going to debate whether it's a good idea or not. And she entered into a debate with the whole audience. And afterwards, Ken Shine, who I actually knew, came up to me, put his arms around me, and said, "What have you produced?" That was a Suzanne story. Suzanne always had messages for people. And I will end with a message you probably didn't expect. And it's really directed at lots of women in this crowd. Most of you must be leaders where you are, and you've done well in life in order to earn a trip to Leapfrog. One of her big sources of disappointment as she rose in the kind of firmament of leaders in healthcare as a woman was that the women who were other leaders, she thought she would draw closer to them and would work with them and partner with them to further the cause of women leadership in medicine. And she found, to her amazement and to her horror, that she actually, as she became more and more prominent, had more and more trouble communicating with other women who were leaders. And she was always very sad about that. She knew the lesson that some people have said in competition: when you have competitors, the best way to succeed is to help competitors succeed. If you make trouble, help other people make trouble. She was interested in transparency. I'm interested in transparency. We together, in part, in our family, invented something called Open Notes, in which all patients now are invited to read the notes that we doctors write. We made a lot of enemies that way, but we work with a lot of other people, and now we're national law. And she was proud of that, and she and I were colleagues in writing about that and thinking about that. I have a lot of competitors, and I try to become friends with my competitors and help them succeed. And she would urge all of you, whether male or female, to work with your competitors and help them succeed rather than try and beat your brains out. So that's the message I think she might have given if she were here. Thank you very much for inviting us. Thank you for doing this.